Lots of patients think that when we do a knee replacement, we chop out a huge segment of your leg and put in this huge metallic implant. And in actuality, think of it as a resurfacing. So if this is the normal knee, the end of your thigh bone is covered in cartilage. Top of your shin bone covered in cartilage and has a meniscus, and then you have the kneecap and the tendons in front. When we do a knee replacement, what we're doing is just resecting the cartilage and a little bit of bone to make up for the metal and plastic that we're going to put in. So once we've made all the bone cuts, you can see that most of your knee is still yours. We've shaved off the end of the thigh bone, the front and the back, and we've flattened the top of the shin bone and removed the meniscus. And this allows us a space to put the implant in. The implant's made of metal, looks like the letter C, taps the end of your thigh bone, and you can see that the majority of your bone is still yours. These ligaments on the side of your knee, the collateral ligaments, they're yours, they still stay, and the top of the shin bone gets a metal plate that either gets press fit where your bone grows into it or cemented in place, and attached to that is the plastic insert. Think of that essentially as your new cartilage and meniscus. The last part in the majority of cases is we resurface the back of the kneecap with a piece of plastic. So the front of your kneecap is still your bone because it's attached to your quad tendon and patellar tendon, and that's what allows you to straighten your knee. But on the back side, if you could flip it over, there's a little piece of plastic, and that's what rides in this little groove on the top of the thigh bone. So that's what a knee replacement is.